Welcome back, viewers, to Faith and Discipline podcast. Our guest today is Dr. Nadeem Anwar. He is a respiratory consultant. Welcome, Dr. Anwar, to Faith and Discipline podcast.
Thank you.
What is interstitial lung disease?
Interstitial lung disease, or ILD in medical terminology, are scarring of the lungs in layman terms.
What are the symptoms of ILD?
The symptoms, usually patients start with cough, and they can be breathless. Sometimes they start with breathlessness when they're walking uphill, but slowly it builds up over the months to years, and patients can become breathless even walking flat. When they started noticing breathlessness, they seek help from the medical team. So those are two major symptoms. Third symptoms, they can have low oxygen levels, and they can actually have some phlegm sometime, but rarely.
Okay, but when a patient is breathless, there might be other symptoms. They might have angina type of symptoms, we call dyspnea. They also might have like asthma. So how do you differentiate what is the problem?
So that's where the history and examination comes. When they come and see the doctor, general practitioner, it's very crucial for them to differentiate between different causes of breathlessness. There are plenty of causes. One of them could be cardiac causes, and cardiac causes like angina, you mentioned, AF, irregular heartbeat, heart failure, and there are plenty of other reasons like anemia, and there are plenty of reasons for lung problems to cause breathlessness as well. So one of them is interstitial lung disease, and other common causes are asthma, COPD, and sometimes having fluid around the lung. So doctors have to examine and take a proper history to differentiate between them.
Okay. For our viewers, would you like to explain what is scarring of the lungs and is it reversible?
So there are two types of scarring. If it's caught early and at the stage of inflammatory process, then there's a good chance that we can reverse it, or we can control with the help of immunomodulators, especially with the steroids or some other immunosuppressants. And second type of scarring, which we call idiopathic, which means that there's no provoking factor. If it sets in, there's no cure, unfortunately, but what we can try to do is try to control it and reduce the progression of the disease with the help of antifibrotics.
What are the reasons for this disease to set in?
So there are tons of reasons, to be honest. What we differentiate between two of them is inflammatory and fibrotic stage. So inflammatory causes could be, some people can have connective tissue disorders like rheumatoid arthritis, lupus. They can have systemic sclerosis, and there are plenty of other reasons like having birds at home. That's a lot of laymen don't know that keeping birds and feeding the birds on a regular basis for months can develop interstitial lung disease. So if they are going to be exposed to the birds, they should wear the proper PPE to avoid any sort of interstitial lung disease. And not many people, even not many physicians, know that feather pillows or feather beddings is a high risk of developing interstitial lung disease. And there are some drugs, there's a big list of drugs which can actually cause ILD as well. So those are the common ones. And occupational exposures like inorganic or organic dust exposure can be a big culprit causing interstitial lung disease. And the other type, which is fibrotic, which means is idiopathic. Idiopathic means unprovoked. There's no underlying, and this is just a degenerative process of your body which sets in and causes idiopathic pulmonary fibrosis.
When you mention about the birds, that's quite interesting to know. Can it happen due to all the birds, or is there a certain species which that can cause ILD?
So more specifically, birds can be budgies, parrots, which people usually keep at home. but not with a lot of other. Sometimes we've seen some patients, they keep chickens at home and they can develop as well, very rarely.
How do you diagnose this condition?
So what we need to do is, first of all, examination. Then you suspect if there is fibrotic crackles on your chest examination. Then you would do spirometry or full lung function test, and you will need to do chest X-ray. If chest X-ray shows some signs of scarring, then you would lead on to high resolution CT scan of chest.
Okay. And what are the treatment options available to treat this disease?
So as I said, there are two types. One is inflammatory. So if it's inflammatory stage and is not fully established pulmonary fibrosis, then we can do immunosuppressants like steroids or some other strong immunosuppressants like mycophenolate and azathioprine. And if somebody has got ILD along with the connective tissue disorders, then there are other options like cyclophosphamide, rituximab. So strong immunosuppressants can be used. But if it's idiopathic, which is unprovoked pulmonary fibrosis, then there are two main options, antifibrotics. One of them is called nintedanib or pirfenidone.
Okay. So immunosuppressant, how long can you prescribe to the patient?
So we need to start them and assess in 6 weeks what's their response, and with the chest X-ray and breathing test and physical as well, that how is patient behaving on the steroids, and then you need to decide how much is the dose and what's the alternative treatment options you can give.
Is it more common in adults or children or both?
It's more common in adults. I've hardly heard of any children developing unless they've been exposed to heavy inorganic or organic dust. I totally forgot to mention smoking is one of the major risks, which increases your risk significantly.
Okay.
Around 60 to 80% of developing interstitial lung disease. Smoking is one of the major factors, but more or less this is a disease of adults.
Is there a link between ILD and medications? If yes, which are those medications?
So as I mentioned earlier, that there's a clear link between the medications, and some medications we know they can cause interstitial lung disease. Common one are amiodarone, nitrofurantoin, and some chemotherapies like bleomycin, busulfan, and previously we used to use gold for rheumatoid arthritis, which has been found to be a culprit for ILD as well.
Medication for rheumatoid arthritis, I believe there are a lot of people who are using that medication. How do we know which medication is more suitable for the patient and it will not lead to ILD?
So there are a few problems with those disease modifying drugs. One of them is ILD, but rheumatologists have to keep an eye. If they're developing any signs and symptoms of ILD, then they need to immediately stop them and refer them to chest physicians. But as I said, every medication which is a strong immunosuppressant has some side effects. Whether it's ILD or they can have immunosuppression, they can develop severe infections which can be fatal as well. But this is the duty of the physician to make sure that he or she is closely monitoring those patients.
Can ILD lead to serious or life-threatening health conditions?
Yes. So in the past, idiopathic pulmonary fibrosis had a prognosis of 3 to 5 years. But now with antifibrotics, we can prolong it to 5 to 7 as an average. Okay. So for the median of survival was 3 to 5, now 5 to 7. Okay. But this is median. Not everybody falls into that criteria.
Okay.
But other conditions like inflammatory ILD has a long survival.
Okay. So if anybody has scarring of the lungs, their lifespan can be reduced to 3 to 5
It's
years.
idiopathic, unprovoked pulmonary fibrosis.
Otherwise, it is more longer than that.
Yeah.
Okay. So how can we prevent ILD? Because it seems quite life-threatening and serious condition. What
It
can
is
we
a
do?
serious condition, but some conditions like inflammatory ILD, then you have to be vigilant. Your physician has to be vigilant. If there's any symptoms of breathlessness, seek immediate help from your GP plus minus specialist. They need to examine it properly, pick it up early, and try to find out the culprit. If it's occupational exposure, we need to find the culprit. If it's like a bird's exposure, we need to find it early and prevent like permanent fibrosis. And similarly, I've picked up quite a few cases with the feather pillows. So they develop ILD, but if we pick them early, we can prevent it and reverse the process. So you have to reduce the triggers. But idiopathic is just an age-related and it's a degenerative process. You can't predict it. So once it sets in, you just have to treat it.
Okay. Important point regarding the duck feather or goose feathers, because a lot of people like those pillows and even duvets because they are quite warm in winter, especially in the Western countries. Is there any exposure like time span? How long do they use that product and it cause ILD? Or for some people they use lifelong and doesn't happen, and for some people they're more immune to it?
Absolutely. So some patients might develop in weeks.
Okay.
So at least 6 to 8 weeks or even more than that. So it's a prolonged exposure. It's more of a hypersensitive reaction of your body to all those allergens, like asthmatics react to pollens, dust, grass. So it's similar to that. But some patients, they might never develop ILD. So it depends on how susceptible your body is.
And my final question is general advice for the patients who are suffering from ILD, how they can manage this disease, because obviously it can be quite stressful for them. Some might need mental health support as well. So what is your advice?
So first of all, it's crucial for them to understand what is the disease and what's the underlying problem, and accept it, and then they need to work with their physicians that ask them what's the best way to live with this and how to prevent the progression. And rehabilitation is very crucial, like physiotherapy involvement, as well as mental health. Psychological support is because it can be very devastating. If somebody hears that they can be easily depressed, so psychological support is very crucial. And there are plenty of supports available in NHS, particularly like there are helplines, as well as there are some societies which are working hard to support these people. But along with that, obviously, there's a medication, and they need to work very closely with their physician and try not to give up, because there's always a hope.
Many thanks, Dr. Anwar, for your time. I believe the information provided, our viewers will find it very useful.
Thank you.
Many thanks for watching this episode. If you found this useful, please share with your family and friends. If you haven't already, please make sure to subscribe to this channel. Thanks for watching.